Greetings, everybody. This is Pink Frog Yellow Boots from Behavior, working towards achieving holistic health for everybody. When we speak of gastrointestinal concerns such as IBS, that is Irritable Bowel Syndrome, we also find that they have been closely related to anxiety, depression, mood swings, and other psychological conditions. The body comprises of your gut system, your immune system, where the processing of the food that you are eating happens. The gut is considered as a second brain and has a major role to play in your overall health. It impacts your psychological, mental, and physical health, all three. When we speak of this, we are speaking that gastrointestinal concerns may lead to a lot of psychological issues, or psychological issues may lead to gastrointestinal concerns. The correlation is yet being researched, but still there are findings that find the correlation between them. So when we speak of this, we are speaking that maintaining this health is important before they become a vicious cycle where one leads to another. Thus, when we speak of anxiety and depression or other psychological disorders, we are speaking that a lifestyle change, a psychological help may help in these issues. That is gastrointestinal concerns, that is GI concerns, specifically IBS, that is irritable bowel syndrome. So, when we find ourselves in a situation where you are constantly triggered because of a systematic change regularly happening that bothers you or hinders you to continue with your daily activity, it might be time that you see through it in a more serious manner and consult your doctor and, if needed, a psychological helper to get through it. GI can be triggered by eating, by stress, emotional arousals, that is hypersensitivity towards your emotions or overwhelming emotions. It can also be due to infection in your system, menstrual periods, gaseous formation, when the brain constantly feels anxious about such concerns. It is becoming a psychological thing. It has also been found that negative emotions or negative mood do impact the gastrointestinal functions. It causes a lot of pain, irritability, anxiety, restlessness, loss of appetite, disturbance during regular day to day activities. So, if it leads to worry, a constant worry about mild, minor, or more changes in the stomach area, in your digestive tract, or you are constantly vigilant about the changes, that is, your attention is increased towards those changes and it is bothering you that much, it might help taking psychological consultations. It has been found that psychological treatment, hand in hand with medical treatment, is far more helpful to deal with GI, specifically IBS. It leads to understanding better of your anxiety and other psychological disturbances so that you can cope with them and get through the cycle that has become a bother to your day to day functioning. With psychological help, the moods, the emotions, the stress and anxiety can be worked with, which will break the cycle of anxiety being created due to GI issues and GI issues creating the psychological conditions. The correlation is yet to be found, the cause is still being researched, but this is something that has been found to be helpful. Also, when you visit a psychologist who practices psychotherapy for your IBS, it is helpful to be honest and open to receive the information, the therapy, the changes that they suggest. Also, change in your lifestyle, being mindful of your thoughts, having a regular activity time for yourself helps a lot with anxiety as well as GI symptoms. Ask for behavior therapy, relaxation therapy that can help from your physician or your psychologist if at all you are visiting them or if at all you plan to visit them. Have a thorough talk about what symptom it is. A lot of time GI is also a build up of a lot of repressed emotions, lot of bottled up things that you have or situations that you are dealing with. So talking always helps when done with a professional. I hope this helps. See you next week.